Yeah, I'm super excited. I think we're gonna have a lot of people, and we're gonna get this on the news tomorrow. Anyway, I think someone's gonna roll on the actual town hall and then put something together for the later shows. We'll have this in the morning. Tonight at 10, I think we're gonna promote it as well, and then all throughout our morning show, promote it, and then tomorrow night somebody will have more on the.
Oh, good. That's great. PR. See, when you get Christina Watkins, all of that is a package deal. I love it.
Listen, this is much needed PR. We all need mental help, okay? We all need to talk about it.
Yeah, absolutely. Let's not even pretend.
No, for real, like not even. So let's go ahead and get started, Dr. Dunham, just for documentation, first and last name, please.
Rochelle Head Dunham, Dr. Rochelle Head Dunham.
Okay, let's talk about tomorrow. So what can people expect during this virtual town hall tomorrow?
So Don't Mask Your Feelings is a lively 1-hour conversational event hosted by the City of New Orleans and Metropolitan Human Services District, moderated by yours truly, with panelists discussing the emotional and coping experiences of persons in care. We'll also be discussing the impact of COVID, the vaccines and vaccinations, as well as the impact of a myriad of stressors on our emotional health, as well as the impact of substance use that's enmeshed in all of this. We'll also spend some time talking about coping strategies, because it's not okay to spend all the time talking about the problems without talking about some recommended solutions.
Yeah, Dr. Dunham, all of that coupled with the fact that this is normally a busy time for everybody, whether you are involved in a club or a crew, you are doing something in some way, shape, or form, like this is a time when we are alive.
Yes.
And that's not happening. So how would you say, without giving too much away for tomorrow, but how would you say some of the changes in carnival season affected all of us, really?
Yeah. Well, you know what? I think the way I think about this is that, first of all, we are an extremely socially engaged community here in New Orleans, for one. The other thing, though, is that we are also a community very much entrenched in traditions. In fact, our traditions is our drug, right? And it's really like an addiction. As an addictionologist, these things all make sense to me. So I say that because we are really hardwired, and this is how addiction works. You are hardwired to expect it to happen. And in our case, we're hardwired to expect our traditions to go without blemish or hiccups. We also crave doing them, right? We look forward to them. We center our lives around them. We plan our vacations around them. We go to work or not go to work around them. And we continue to do them despite any adverse consequences. For example, the issue with the bar closures, there was guidance that people could have followed. That's my understanding, to prevent that. But because of just the intense need to continue to engage as we always have, it resulted in the changes. So hence the cancellation of a century-old tradition like Mardi Gras is devastating for many, and shifting to something new to satisfy that high it brings is not only difficult, but it's depressing and it's frustrating for so many people. So all of our family activities, our festivals, our second lines, engaging in, bar and social events, all of this for so many is just emotionally very destabilizing and disconcerting.
Yeah, it definitely is. I just let Claire in. I saw her name pop up on the side. Claire, are you here?
Yeah, she's here.
Okay.
I see her. She's connecting.
Okay. All right, cool. So if Dr. Dunham, like if all of these things, this, so to say, addiction that we all have connected to carnival season and the things that come along with it, if we don't address how we are feeling and how the loss and the changes make us feel, what kind of impact do you think it could have on the community?
Well, you use the proper term, which is loss. What we are experiencing as a nation, as a community, is grief and loss. And grief and loss require some things to happen in order for you to get past it. And if you think about any losses that you've had, there is a process that has to occur for you to move on. But you will have days that are worse than others. You will have moments that are more difficult to get through than others. But conversations are huge. It's one of the simplest things that we are able to do as human beings, and yet it is one of the least things that we do, particularly when things are difficult. We could settle a lot of things by just talking with somebody about what is going on in your mind, in your heart, in order to diffuse some of that bad energy, and then to expose yourself to the possibility that somebody might say something that lifts you or gives you another alternative or helps you to think about things differently. So for sure, conversation is really, really important. And it doesn't have to be with a trained person. It could be with a trusted person who, a child, sometimes our children say some of the most profound things because they aren't carrying the weight of life all day. And they also have great recommendations too, if we will just allow ourselves to relax and release a bit and allow us to engage in those things. So substituting other activities in your life in place of the things that you are mourning or have lost. Nothing lasts forever, Christina, nothing lasts forever. Everything is meant to be in a part of a phase of our lives. And if we start to adopt that kind of attitude that permanence is a fallacy, then we create in our minds and our ability a nimbleness that's necessary to get through times like this. And so I think we are going through a period of mourning what has been and will not be probably ever again. And I think accepting that, which is a part of grief and loss, that what you loved may very well be gone forever, is a first step at allowing yourself to bring into your heart and your mind different in order to free you from the pain and the weight of what you have lost. So substituting other activities, being open to explore old and new activities that are emotionally settling are all so very, very important.
Yeah, kids, by the way, will keep it all the way real with you, even when you don't want to hear what they have to say. The realest ones, you got a 6-year-old who'd be like, Mommy, your breast stinks. What are you doing?
Yeah, that's right. That's right.
I love it.
Get dressed.
Right. Why are you wearing that? What is going on?
Yeah.
Dr. Dunham, anything else you want people to know about tomorrow? Anything you want to tell them to get them to go ahead and register, log on, and join us in this conversation?
Yeah. Make sure that you prepare, come online. They could register a little bit early to make sure that they get all the kinks out of their systems, and tell other people. And perhaps, in your pod, try to get your pod, the people who are close with you, to watch it with you. And then also have conversation beyond the conversation about what we're discussing. And if everybody can adopt one new thing that they're going to do as a result of this conversation, I think that can begin the process of healing and recovering as we go through this period of tremendous change in all of our lives.
Perfect. Thank you. Let me go ahead and start